At Oticon Medical, we are constantly driven to develop better solutions for professionals and users of bone-anchored hearing systems. Solutions that improve both outcomes and the treatment process. The minimally invasive mono procedure has made a leap in innovation by reducing drilling to just one single step. This video demonstrates the placement of a Ponto BHX implant using the mono procedure and the tailor-made mono surgery kit. The mono procedure is a single-stage procedure which is indicated for adult patients with normal bone anatomy and expected bone thickness of at least 5 millimeters, where no complications during surgery are expected. Possible reasons for expecting thin bone may include previous surgery in the area of the implant site and/or congenital craniofacial or auricular anomalies. For these patients, an alternative procedure for implant installation is recommended. The components needed to perform a mono procedure are all included in the tailor-made mono surgery kit. The sound processor indicator is useful to identify the best possible implant position in relation to the ear, approximately 50 to 55 millimeters from the ear canal. Properly placed, the indicator must not touch the pinna or other personal assistive devices like the patient's glasses. Mark the implant position. To choose the correct abutment length, measure the soft tissue thickness using a thin needle and the Oticon medical ruler. A 5 millimeter soft tissue thickness measurement suggests a 9 millimeter abutment. During a mono procedure, usually local, sometimes general anesthesia is used. An incision hole is made using a biopsy punch. A 4 or 5 millimeter punch can be used. Rotate the punch to incise the periosteum. Remove the periosteum at and around the implant site using the double-ended dissector. It is important that all periosteum and soft tissue is removed at the site. Carefully insert the cannula. Let go of the cannula so it can find its natural position in the tissue. Ensure the soft tissue is not tensed. There are a few important aspects to consider when drilling with a cannula. First, please note that the cannula primarily acts as protection for soft tissue and is not a fixed position marker. Ensure the following: that there is no soft tissue between the cannula and the bone, that the top of the cannula is parallel to the skin, and that the cannula is pressed against the bone throughout the procedure. That the cannula is filled with saline to facilitate cooling. Continue to irrigate generously during the entire drilling procedure and flush the cannula excessively immediately after drilling. The mono drill must always be used together with the cannula. The cannula provides the stop that prevents drilling deeper than intended. That the drill is inserted to the bone level before starting the drill. Use a single downward and upward drilling motion to avoid overheating the bone. Position the cannula with the top surface parallel to the skin and press firmly against the bone. Fill the cannula with saline solution prior to drilling. The recommended drill speed is 1,500 to 2,000 rounds per minute. Insert the mono drill to bone level. Use a single downward and upward drilling motion. Keep the drilling procedure below 4 seconds to avoid overheating the bone. Stop drilling when the stop collar of the monodrill reaches the top of the cannula. Carefully check the bottom of the hole for bone with the double-ended dissector or another blunt instrument. Leave the cannula in place until you are ready to install the implant. Set the drill unit to low speed with automatic torque control. An initial torque setting of 40 to 50 Newton centimeters can be used. In softer bone, it is important to use a lower torque setting to avoid damaging the drilled hole. The insertion indicator is attached to the abutment inserter and mounted on the handpiece. Pick up a 4 mm implant with pre-mounted abutment. Remove the cannula from the site. Place the implant axially aligned in the drilled hole and start inserting the implant. It is important that the implant is inserted in line with the drilled hole and that it is fully inserted. When the implant engages in the bone, count the number of turns. 5 turns are an indication that the implant is fully inserted. Lift the handpiece straight up to release the abutment inserter instrument from the abutment. Attach the soft healing cap onto the abutment. Ointment-soaked ribbon gauze is wrapped around the abutment. Apply the dressing evenly and in appropriate quantities to create a light pressure against the skin to avoid hematoma, but still allow proper blood supply. Please refer to the surgical manual and addendum, including the mono procedure, for a complete instruction of the procedure and description of patient indications, contraindications, warnings, and precautions. During a mono procedure, a decision to change to a linear incision technique can be made at any time. The monodrill can still be used, but the monodrill must always be used with the cannula to prevent drilling deeper than intended.